Right now, we're putting on our detective hats and stepping straight into the shoes of an assessing nurse. We've got a true clinical mystery on our hands today, one that requires really sharp observation, connecting the dots, and knowing exactly what clues to look for. The focus of our investigation, a very specific and heavily tested pediatric condition known as Juvenile Idiopathic Arthritis, or JIA for short. Okay, let's dive into this. Picture this high-stakes scenario. You're working at the clinic, and a very worried parent brings in their child. The main complaint? The kid is waking up with stiff, swollen joints every single morning. Obviously, it's a super distressing situation for the family, and as the assessing nurse, your mind instantly starts cycling through the possibilities. Could this be juvenile idiopathic arthritis? Well, this is exactly the kind of presentation every single nursing student and pro needs to recognize in a heartbeat.
Section 1. Key assessment clues. Let's look at the initial physical evidence we need to gather right off the bat. So, when you're assessing this pediatric patient, you're going to rely heavily on what you can actually observe and physically feel on the child's body. We're looking for a triad of major symptoms here: stiffness, noticeable swelling, and a really limited range of joint movement. But remember, you aren't just looking with your eyes, you're using your hands. When you palpate those affected areas, you're going to feel that the joints are actually warm to the touch. They'll be highly tender, and the child will definitely tell you they're in pain. These are your absolute foundational on-the-ground findings.
Now, what's really interesting about this slide is the wild clinical contradiction of how JIA behaves. It's totally counterintuitive, honestly. See, after periods of rest, like, sleeping through the entire night, that severe stiffness comes roaring back. But as the child gets up and engages in periods of activity during the day, the morning stiffness actually improves. It's wild, right? This specific relationship, rest causing stiffness, but activity relieving it, is a massive hallmark clue for your assessment. Section 2. The silent threat. As we move forward, we need to slow down for just a second to discuss a very grave hidden risk.
Because beyond the joints, you absolutely have to watch out for uveitis. Uveitis is quite simply an inflammation of the eye, and it is the silent threat of JIA. Why are the stakes so high here? Because if this specific symptom slips under your radar and goes untreated, it can literally lead to permanent vision loss for that child. As a nurse, knowing to connect joint stiffness with the potential for severe eye inflammation, that's exactly what elevates your practice and protects your patient from irreversible damage. Let's move to and see how this builds. Section 3, cracking the diagnosis. Now that we have our physical evidence, how do we actually confirm what we're looking at?
Well, here's the core diagnostic challenge. There is absolutely no single test to diagnose juvenile idiopathic arthritis. You can't just draw some blood, check for one magical marker, and have a definitive answer. No way. Instead, clinicians have to rely on a combination of clues. You have to take all those physical assessments we just went over and pair them with specific lab and imaging data to truly crack the case. So, the crucial point is knowing exactly what you're looking for in your diagnostic toolkit. Let's break it down. Under blood work, you want to watch for an elevated ESR. That's erythrocyte sedimentation rate, which points straight to inflammation in the body. You'll also want to look for leukocytosis, which is simply an increase in white blood cells. Then, when you turn to your imaging, you aren't just looking at the bones themselves. You're looking for soft tissue swelling and widened joint spaces. Why? Because of an accumulation of excess synovial fluid. That right there is the definitive piece of the puzzle that backs up the swelling and limited movement you found during your physical assessment. Section 4. Advancing your nursing career. Because grasping these complex clinical scenarios is just one step in a much bigger journey. And this brilliantly illustrates where you can turn to really master all these complex concepts for your long-term success. Complete RN Solutions. They act as the ultimate educational mentor for both nursing students and seasoned pros alike. Their core mission is beautifully simple, but honestly, it's highly impactful, empowering nurses and advancing careers through comprehensive nursing education. They provide a rapid-fire toolkit of services designed to basically guarantee your success. They offer dedicated NCLEX review courses to make absolutely sure you're ready for your boards. On top of that, they've got specialized EKG courses, plus ongoing professional development resources. By breaking down really tough medical conditions into simple, bite-sized nursing lessons, kind of like what we did today with JIA, they empower nurses to elevate their practice and advance their careers. Which brings us to our final thought for today. Are you ready to pass with confidence? Make sure you save this information, especially those key JIA assessment and diagnostic markers for your NCLEX review. And definitely be sure to follow Complete RN Solutions for even more simple mastery-level nursing lessons.